Hey guys, and welcome to How to Gastro. So in today's video, we'll be discussing what is a PTT blood test, which is also commonly known as a partial thromboplastin time blood test. So let's get started. So before we get into the specifics of the PTT blood test itself, let's talk a little bit about what you can expect when your doctor orders this test for you. So a PTT blood test is a simple test that can be done at your closest laboratory. No special preparation is needed for a PTT test, which means you don't have to fast, so you can eat and drink as usual before the test. So during the test, a blood sample will be collected from you, which means that a needle will be inserted into a vein, usually in your arm, to draw out some blood into a blue top or a citrate blood tube. And then this blood tube is then sent off to a laboratory where it is analyzed and resulted. So this is basically what the blue top blood tube looks like, and this is how a PTT blood test is done. So now that we know what to expect during the process of a PTT blood test, let's talk a little bit about what the PTT blood test is all about. So what is a PTT blood test? So the partial thromboplastin time, or PTT, also known as the activated partial thromboplastin time, or APTT, is a screening test that helps to evaluate an individual's ability to appropriately form blood clots. It measures the number of seconds it takes for a clot to form in a sample of blood after substances such as reagents are added to it. So PTT tests can assess the amount and the function of certain proteins in the blood, called coagulation or clotting factors, that are an important part of blood clot formation. So the PTT is used to evaluate the coagulation factors of factor 12, factor 11, factor 9, factor 8, factor 10, factor 5, factor 2, and factor 1. As well as prekallikrein, or PK, and high molecular weight kinagen, or HK. So now that we know what this test actually is, let's talk a little bit about why doctors might order this blood test for you. So doctors may order a PTT blood test for the following reasons. Number 1, for diagnosing bleeding disorders. So as mentioned in the previous slide, the PTT test helps in identifying disorders that affect blood clotting, such as hemophilia. This test is also important at number 2 for monitoring anticoagulant therapy. So patients on anticoagulant medications like heparin often undergo PTT tests to ensure that their blood is not clotting too quickly or too slowly. The third reason doctors may request this test is for pre-surgical evaluation, and this is to assess any bleeding risks before surgery. The fourth reason is to evaluate liver function. So since the liver produces many clotting factors, this test can be used to assess liver function indirectly. So these 4 reasons are the 4 basic reasons why doctors may order this blood test for you. So now let's talk a little bit about the normal ranges of a PTT blood test. So the normal range for PTT is between 25 and 35 seconds. So in cases of a prolonged PTT, this means that the PTT is longer than the normal range, which means more than 35 seconds. It may indicate a clotting disorder or the presence of anticoagulants like heparin. So a shortened PTT, on the other hand, could suggest a higher likelihood of forming clots in the body, which can actually lead us to conditions such as thrombosis. So this means a PTT which is below 25 seconds does alert us to a higher likelihood of clots forming in the body and for the patient to be aware of conditions that cause thrombosis. So let's dive a little deeper now into the abnormal ranges of PTT. So as mentioned in the previous slide, a prolonged PTT indicates that it takes longer than normal for blood to clot. This can be caused by various factors, including number 1, coagulation factor deficiencies. So under this category, we have hemophilia A and B, and we have von Willebrand disease. So in hemophilia A and B, these are genetic disorders where specific clotting factors, mainly factor VIII or factor IX, are deficient or defective, which will lead to issues in blood clotting. In von Willebrand disease, this is a condition which is caused by deficiency or dysfunction of von Willebrand factor, which helps the platelets stick to the blood vessel wall and also carry factor VIII. So here in von Willebrand disease, there's a dysfunction of the von Willebrand factor, which prevents the proper aggregation of those platelets or the clumping together of those platelets and prevents them from sticking to the blood vessel wall, which also means here that it's going to take much longer for the blood to clot, meaning that we're going to have a prolonged PTT. At number 2, we have anticoagulant therapy, such as heparin therapy. So heparin is a blood thinner and is commonly used to prevent blood clots from developing in the body. Heparin prolongs the PTT by inhibiting clotting factors. So also in the category of anticoagulant therapy, we can have direct oral anticoagulants or DOACs. So here we have anticoagulants like dabigatran, which can also affect the PTT by prolonging it. At number 3, we have liver disease. So as mentioned in the previous slides, the liver produces most of the clotting factors needed for the clotting process, which means that in cases of liver disease, such as liver cirrhosis or hepatitis or liver failure, this will lead to reduced levels of these factors, resulting in a prolonged PTT. So continuing with causes for abnormally high PTT results, we have at number 4 a vitamin K deficiency. So vitamin K is necessary for synthesizing several clotting factors such as factor 2, factor 7, factor 9, and factor 10, which means that a deficiency in vitamin K can lead to prolonged PTT, though it most commonly affects the actual prothrombin time, or the PT. At number 5, we have DIC, or disseminated intravascular coagulation. So DIC is a serious condition where the clotting system becomes overactive, leading to the consumption of clotting factors and platelets. And this in turn paradoxically causes both excessive clotting and bleeding, often prolonging the PTT. At number 6, we have lupus anticoagulant. So despite the name, lupus anticoagulant is an antibody that increases the clotting risk, but can prolong the PTT in lab tests. So it is associated with autoimmune conditions, particularly antiphospholipid syndrome. At number 7, we have specific factor inhibitors. So sometimes the body produces antibodies against specific clotting factors, such as factor VIII inhibitors, for example, which can also lead to a prolonged PTT. And finally, at number 8, we have inherited clotting disorders. So other rare inherited conditions can cause a prolonged PTT due to deficiencies in clotting factors, such as factor 11 deficiency. So now that we've explored all the causes for abnormally high PTT results, let's take a closer look at the causes for abnormally low PTT results. So a shortened partial thromboplastin time means that the blood clots faster than expected. And this is usually less common than a higher PTT result, but can also be caused by various factors, including number 1, increased levels of clotting factors. So elevated levels of certain clotting factors, like factor 8 or fibrinogen, which is factor 1, can speed up the clotting process, resulting in a shortened PTT. And this can occur in conditions like pregnancy, inflammation, or infection. At number 2, we can have early stages of DIC, or disseminated intravascular coagulation. So in the initial phase of DIC, there can be an increase in clotting factors, leading to a shortened PTT. But as the condition progresses, PTT often becomes prolonged, as we saw in the causes of increased PTT. Coming in at number 3, we have thromboembolic disorders. So conditions that predispose individuals to excessive clotting, such as a DVT or deep vein thrombosis, or pulmonary embolism, might show a shortened PTT on a blood test as well. At number 4, we can have technical errors. So sometimes a shortened PTT showing up on a blood test result can be due to errors in the collection or handling of the blood sample, such as using a small sample size, improper mixing of the sample, or the presence of tissue factor from trauma during the venipuncture process. So these are all reasons why we may have an abnormally low PTT result showing up on the blood test. At number 5, we have high levels of factor VIII. So this can be due to various reasons, including stress, inflammation, or as an acute phase reaction, which will all also lead to a shortened PTT result. And finally, number 6, which is hypercoagulable states. So in conditions where the body is predisposed to clot formation, such as in certain cancers or inherited thrombophilias, the PTT here will also be shortened. So as we have just seen, the PTT test is a crucial test in both diagnosing and managing various conditions related to blood clotting. It helps to ensure that patients receive appropriate care, whether they are at risk for bleeding or of forming clots. And that brings us to the end of this video. So thank you guys so much for watching. I hope you found this video very interesting and informative. Please make sure to like, comment, subscribe, and share this video with some of your friends in the medical community. So I've just recently signed up for Buy Me a Coffee. So if you want to encourage me to do even more, or to say thanks for all the free information you've received on my channel today, you can buy me a coffee by clicking down in the description box for the link. Take care and have an amazing day further. Bye for now.